In the first section of our lecture, Genital Tract Injury, we will talk about the Old Complete Perineal Tear. In this, we will talk about the genital tract injuries, what are the causes of genital tract injuries, and what are the signs and symptoms of genital tract injury or complete perineal tear. The genital tract injuries. The genital tract injuries can be spontaneous or assisted, or they more in areas of inadequate antenatal or intranatal care. This is very important. Even nowadays, in some areas, the prenatal care is not very good. So when the prenatal care or antenatal care is not good, usually the patients, when they come for delivery, this is usually their first time ever to see the doctor during the whole pregnancy, 9 months of pregnancy. So it's very, very bad because the doctor doesn't know anything about the patient. If they have if they have good enough capacity to deliver the baby, what's the position of the baby, so nothing is known. So in those cases, usually it's very common to have genital tract injuries during the delivery of the baby. So here, if you see, we have the obstetric legacies which leads to gross gynecological problems. Some problems, obstetric legacies that can lead to gynecological problem. One is the genital prolapse. Then the perineal injuries including complete perineal tear, genitourinary and rectovaginal fistula, tender perineal and vaginal scar, backache, eversion cervix with cervicitis, and ill health and chronic debilitating state. So all these are the conditions which can cause gross gynecological problems. These are in this diagram we can see there are the 4 degrees of perineal tear. Degrees of perineal tear. First, what is the perineum? Perineum is the area between the vagina and the anorectum or anus, opening of the anus. So that's the perineal area. We have the 4 degrees of perineal tear. In the first degree perineal tear, there is only the involvement of the skin. So in this, usually no repair is required. Usually the injury or lesion heal on its own. So first degree involvement of the skin. So if you see, second degree is more, it involves the perineum and it involves the posterior vaginal wall also. It's as compared to first degree, it's lot of more damage. But both first and second degree perineal tear, it is advised usually, or it is recommended that they should left open, and usually the lesion heal on its own. It takes a time about 3 to 4 weeks, and it about a month before the patient feels little better, but it heals on its own. But with the third degree, it's a deep cut that involves the perineum and the muscle, and this here, and for this type of perineal tear, usually the suturing or repair is recommended. And then also in the fourth degree, it is almost it involved the anal sphincter also. and it is more type of tear, more advanced, more deep, and for this sphincter again the perineal tear, for this type of perineal tear needs the repair surgery. So genital tract injury, they can be spontaneous or assisted, and in areas where there is poor antenatal and intranatal care, usually home deliveries when there is no concept of episiotomy, the tears are bad or sometimes very severe or serious. Old Complete Perineal Tear is the tear of the perineal body involving sphincter ani externus with or without involvement of anorectal mucosa. So it's the complete old perineal tear is in which the perineal body is involved along with the sphincter ani externus is the muscle, sphincter anus, or is the sphincter of the anus that is responsible for opening and closing. So when that is affected, usually there is also incontinence or fetus incontinence also present, with or without involvement of anorectal mucosa. First degree of complete perineal tear, usually there is laceration of vaginal epithelium or perineal skin. So epithelium or perineal skin is involved in first degree. In the second degree, there is involvement of perineal body but not anal sphincter. Third degree, there is disruption of anal sphincter complex, and in the fourth degree, there is injury to anal sphincter complex with tear of anal epithelium. So as you see, it degree as the from first degree to fourth degree, it is more serious, more complicated, required extensive repair, and when there is involvement of anal sphincter, usually it leads to fecal incontinence, and there is no control because the sphincter is involved that is responsible for opening and closing of the anus or rectum. Now again, what are the risk factors for complete perineal tear? Risk factors are priming gravida. First time pregnancy usually leads to perineal tear. If the baby is big, more than 3 kilograms, usually it leads to perineal tear. Face to pubis delivery, if it's a breech delivery with the face coming first, then it is leads to tear. Midline episiotomy leads to perineal tear. Forceps delivery, outlet contraction with narrow pubic arch, shoulder dystocia, precipitate labor, scar in the perineum, and then prolonged second stage of labor. All these are the risk factors that can cause perineal tear. Prolonged second stage from the from the dilation of the cervix to the delivery of the baby, that's the second stage. So if the second stage of the delivery is prolonged, it can cause perineal tear, or if the baby is big, then the area is small or outlet is small, it can cause perineal tear, shoulder dystocia, precipitate labor. It's too much, if there is labor in which too much oxytocin is used or labor is precipitated, it can cause perineal tear. So these are some common cause or risk factors that can lead to perineal tear. The etiology of perineal tear is obstetric. Causes are perineal injury from overstretching or sudden stretching of the perineum during childbirth. And gynecological causes are direct injury on the perineum by fall may lead to trauma on perineum. So if there is direct injury as a result of fall, it can leads to perineal tear. And then also if there is sudden overstretching of the perineum during childbirth. Structures which are torn in perineal tear is posterior vaginal wall or perineal skin, perineal muscles, perineal body, anal sphincter complex, and varying degrees of anorectal mucous membrane. So all these are the structures that are involved in the perineal tear. So these are the structure from starting inward to the outward. So first anorectal mucous membrane, then anal sphincter complex, perineal body, perineal muscle, and posterior vaginal wall. Some symptoms and signs of perineal tear. The symptoms are inability to hold the flatus and feces, as I mentioned, because of the damage to the anal sphincter that is responsible for controlling the feces. If that is destroyed or damaged, it can lead to inability or incontinence of flatus and feces. Soreness of the perianal region due to constant irritation by the stool. If there is incontinence of the stool, it keeps on causing irritation around the anal area, and that causes soreness, pain, and redness. Signs of the perineal tear includes absence of perineum, no perineum repair as a result of trauma or injury. Vaginal and rectal mucous membrane are found to be continuous. So as a result of perineum, which is the area between vagina and the rectum, if that is lost or if it is absent, then you see there is a continuation between the vaginal and rectal mucous membrane. Rectal mucosa is reddish and the vaginal mucosa is pinkish in color. Visible dimple on the skin on either side of the fused mucosa may be present. Absence of the sphincteric grip, evidence when the figure is introduced into the rectum. And then differential diagnosis is rectovaginal fistula, causes incontinence to the patient than more inconvenience to the patient than perineal tear. So differential diagnosis that can be made is rectovaginal fistula. If there is connection between rectum and vagina, that is one of the differential diagnoses. So all the signs is the perineum may be absent. When the perineum is absent, there is continuation between rectum and vaginal mucosa, and dimples are present on either side of fused mucosa, and absence of sphincter grip, because when the finger is inserted, there is no grip. That was all about the perineal tear and what are the signs and symptoms and what are the different types of injuries that lead to perineal tear and what are the 4 degrees of the perineal tear. Thank you for watching sqadia.com.